When an individual reaches young adulthood, they're probably going to be done fully growing. Their height will be at their tallest, they'll be at their physical peak in terms of strength and coordination and dexterity, and most of their sensory systems are going to be perfectly accurate. Though for some individuals, your hearing will start to decline, but that's generally related to what kinds of stimuli you expose yourself to. In other words, you should probably turn that music down, just like your mom says. But like I said, for most young adults, they're at their physical peak. 94% of young adults will even say that. They say that their health is good or better. Now, when a person who is in their physical peak in their young adult life, when they do unfortunately die, it's usually due to an accident. And that makes sense. A perfectly healthy person, the only reason they would die is if it was something that was hard to prevent. Now, the people who die the most often in young adulthood are men. So young adult men are 2.5 times more likely to die than women. And men of African background, they tend to be at a higher rate than European. Same with Latino, so that's about 2 to 2.5 times higher than European. And then European are about 2 times more likely to die than Asian or Pacific Islanders. So this is kind of the same pattern we see when we look at other ethnic differences in the data, like IQ scores, for example, and similar kind of indexes. Like, a lot of these things do have a lot in common, where the Asians tend to be at one end and the Caucasians tend to be somewhere in the middle, and then the Africans are at the other end. So that's a typical split we tend to see in the data. As for why exactly that split occurs, that's not an easy thing to explain. There's a lot of factors that go into that. Like one thing that correlates with ethnicities is things like cultural differences, so just cultural practices. Another one is socioeconomic status. Some cultures, people of certain ethnicities just tend to have different levels of socioeconomic status. Another one is living conditions, like where and under what kind of environmental situations you're raised in. And just to name one example, a lot of people from an African background do tend to come from like inner city areas where the living conditions, to put it simply, could be improved. There's crime, there's a lot of pollution, and this can have a significant negative effect on a person's health and longevity. But we'll come back to that later in another video. Regardless of what kind of person you are, there are certain behaviors you could engage in that could significantly shorten your lifespan. Like smoking tobacco, for example. Smoking is in fact the single biggest contributor to health problems in adults. Smoking-related illnesses result in the death of 440,000 US citizens each year and over 100 billion in medical bills each year. Now, a lot of people who smoke chronically, a lot of people who are addicted to smoking, they'll argue that they've been smoking for so long, if they quit now, it's not going to really matter. But that's simply not true. Quitting smoking, it doesn't matter how long you've been smoking, it doesn't matter how much you've been smoking. If you quit smoking, you will see health benefits. The data has consistently shown that. Even people who've been smoking their entire life, if they quit near the end of their life for medical reasons, usually their overall health improves significantly. But it's not just about your health, it's also about the health of everyone around you. Because non-smokers that you live with, or non-smokers that you're just in close proximity to, they also have a negative impact on their health. Over 40% of people are exposed to secondhand smoke. Thankfully, those statistics have been going down due to a lot of public policies. But that secondhand smoke can be especially harmful to certain demographics, like very young individuals, prenatal development as well, and other, like, physically infirm, like elders, they can be more negatively impacted, for example. Besides smoking tobacco, another huge cause of health concern for young adults is drinking alcohol. Uh, Typically, when we look at the data, we see that drinking occasionally is not a source of concern, as long as you're not driving. If you're just at home, which most of us are nowadays, just kind of relaxing and having some alcohol, that's probably not going to be an issue. If you have about 2 glasses of wine or like a couple of beers a day, that's probably not going to be a health concern. We only really start to see health problems arise when people binge drink. And in fact, if people binge drink frequently, then that's going to take a massive toll on your body. And what exactly binge drinking is differs from males to females. We have different definitions based upon the physical differences that we tend to see. Like, men can metabolize more alcohol, so for men, binge drinking consists of 5 or more drinks in a row. I know it's kind of a loose term, but by in a row, I just mean when you finish one drink, you get started on the next. So can't really give you a clear timeline, but you get the idea. For women, it's 4 or more drinks in a row. So like I said, there's differences in how men and women metabolize alcohol, and that's why we see this gender split. But binge drinking, regardless of whether you're a man or a woman, can have some significant impacts on your health. Obviously, it's going to hamper your productivity, and it can promote victimization. That's just a politically correct way to say that if you're getting wasted, people can take advantage of you. So it's clearly pretty hazardous. So binge drinking, though, it's definitely not a U.S. phenomenon. This has been around forever. This is in every country. It's a major international health concern, especially amongst college students. So, being a college student, I don't know how much you've been affected by something like this. I don't know if you've ever been to like a frat party or just like a big party where everybody's drinking before. But if you ever do find yourself in that kind of situation where people are just handing you drink after drink, I can tell you from my experience, it's not going to work out. This is not a good idea. I'm not very happy to admit that I have been to such occasions and it didn't work out too well. I don't want to get into details for various reasons, but the point is, if you're in this age group, 17 to 23 years of age, you are at the highest risk of binge drinking. And if you are a woman in this age group, your risk is much higher because, as I already explained, binge drinking is more easy to do for women. So if this is you, if this describes who you are, and you've had these kinds of experiences and you've never had a bad experience, you should feel lucky. Like, I really don't want to get too graphic, but if you've never binge drink before, it can get to the point where you just feel so horrible that you want it to end. You want something to make this go away. And one thing that you'll be very well aware of is that if you were to vomit, you would be able to get that alcohol out of your system and it would make you feel better. And that isn't exactly true. If people are very drunk and then they vomit, it usually helps them to recover a little bit. So just imagine being in such a state, not being able to really move around much at all, not being able to really think clearly at all, and just like hoping that you puke. It's a pretty horrible condition. We should move on. I don't want to talk about it. It's disgusting. It's unpleasant. Don't do it. And there's another reason why you don't want to go down that path of binge drinking frequently. it could eventually lead to alcoholism. So alcoholism, I'm sure you're perfectly familiar with the concept. It's an addiction to alcohol involving physical dependence and withdrawal symptoms. You develop a tolerance for it. And when I say withdrawal symptoms, what I mean is if you're an alcoholic and you don't get your alcohol, if you don't get that fix, your body will literally start shutting down. You'll start suffering. You'll start feeling really horrible. And until you get the alcohol, you're going to be unable to function properly. You can tell somebody's an alcoholic because when you give them the alcohol, they actually start to act normal. Like alcohol has the opposite effect on them. It wakes them up, it gets them functioning, it makes their brain more active. So while it tends to slow down most people, an alcoholic has actually developed such a need for it that it speeds them up. It completely reverses the function. But alcoholism has very serious consequences. Besides being costly and besides being, problematic in a number of ways, it can also be a significant health concern. It can do permanent damage to your brain and nervous system. Like various neurotransmitters can become dangerously depleted or increased, and various sections of your brain can actually die due to starvation. Because one thing that we see with a lot of alcoholics is they tend to forego eating and drinking like normal liquids for alcohol. So their body is wasting away, their brain is wasting away because they're not getting proper nutrition as a result. But it is a very serious addiction. It is a very hard addiction to overcome because those withdrawal effects can be so serious. A severe alcoholic could in fact die from those withdrawal effects. So it's a very challenging addiction to overcome, much more challenging than pretty much any other drug out there. Now, to help alcoholics recover, there's a wide range of treatments that we've developed, but one particular area, one kind of treatment that I haven't heard people talk about very much are the medical treatments for alcoholism. Maybe you've never even heard of this concept that you could prescribe a medicine to help somebody overcome this addiction. But it is true. There are different medical treatments out there, like disulfiram, commonly referred to as antabuse. This medicine prevents absorption of alcohol, leading to extremely unpleasant side effects after ingesting just small amounts of alcohol. So this medical treatment works via operant conditioning. The person who's taking the medicine, if they drink alcohol, they get punished for it. So the next time they go to drink alcohol, they'll be less likely to want to go through with that action. They'll remember the punishment, and it will dissuade them from ingesting alcohol in the future. But this is kind of an extreme measure. There's other treatments you could go for that don't cause such unpleasant side effects, such as naltrexone, commonly called Revia or Vivitrol. This blocks endorphin receptors in the brain, preventing the pleasure stimulation received from ingesting alcohol. So a person who's taking naltrexone, they're not going to feel sick, they're not going to feel unpleasant, but they're also not going to feel good. When they drink that alcohol, it just doesn't do anything for them. It's like drinking water, basically, like really gross tasting water. They just don't get anything out of it. So over time, that will kind of wean them off the, stimulating benefits of drinking alcohol. And then one last kind of drug that's been shown to be pretty effective is acamprosate, or topiramate, sometimes called Camprol. This helps to reduce those really harmful withdrawal symptoms I was describing. So if a person genuinely wants to get off of their alcohol addiction, you could give them acamprosate, and that will help to more efficiently wean them off. They won't suffer as much when they're reducing their intake. But like I said, a lot of people have never heard of these medical treatments, and it's because when a lot of people think about alcoholism and just drug addiction in general, they tend to think of this as a behavioral problem. Like if somebody's addicted to alcohol, there's something wrong with their character, there's something wrong with their personality. They don't generally look at it like a medical issue. But if we try to, put our judgments aside, if we try to just look at this problem and try to find the best solution for this problem without passing any kind of judgments at all, what we'll generally see is that a medical approach, a medical perspective, provides the most effective treatments. Those treatments that focus on, character and personality growth, like Alcoholics Anonymous, for example, they're not nearly as effective as a lot of these medical treatments. I was surprised by how ineffective Alcoholics Anonymous in particular is. I don't have the data right here to show you, but the percentage of individuals who go all the way through the program, they actually complete the program and stay clean, is incredibly small. It's in the single digits. So yeah, I thought programs like that were a lot more effective, but it just doesn't seem to be the case. Now, besides these hazards, these health damaging things that unfortunately a lot of young adults do, there are just some basic facts that I'd like to share with you regarding adult health. So first of all, there's nutritional guidelines. It is a fact that once you reach adulthood, your body does start to slow down. You're not growing taller, you're not growing more muscles, you're pretty much at your peak at this point. So the amount of energy your body needs, your metabolism, is going to change. You're going to see a lowering in the amount of food you should intake. You should limit intake, particularly for things like saturated and trans fats, cholesterol, sugars and salts and alcohol. And it's important that you do, because it's not only going to affect your weight, it's also going to affect your mental, emotional, and physical health. These things are all connected. Your mind is your body, and your body is your mind. You can't, neglect one to focus on the other. They're one and the same. So when you're not eating right, your body will suffer, and by extension, your mind will suffer. So it's very important to maintain a good, well-balanced diet. Poor diet has been associated with a whole number of problems, such as cancer, heart disease, diabetes, and even amnesia, and a few others. So it's very important to have proper nutrition. Now, the government has done a lot of research into what the best foods are and what quantities, and you've probably seen this graphic before. So what this shows us is that approximately half the food you eat should be fruits and vegetables. And this holds true no matter what your age is. And to break down that grains section, half of it should be whole grains. And just in general, you should try to eat less sugar, sodium, and fat. So those are just some basic guidelines that anyone can benefit from if you try to follow those. Now, cholesterol in particular has gotten a lot of focus from the research. A lot of people are worried about their intake of cholesterol, dietary cholesterol. People worry that intaking a large amount of cholesterol in food will increase their risk of heart disease. But there's actually two kinds of cholesterol. You have something called the low-density lipoproteins, or LDLs. Those are the bad kind. These are the kinds of cholesterols that impede blood flow by causing fatty deposits to accumulate in the arteries. And then there's high-density lipoproteins, the HDLs. Those are the good ones. This is the kind of cholesterol that keeps arteries clear and breaks down the LDLs. So if you are concerned about your cholesterol levels, you can get these things measured by going to your doctor. Uh, when they measure your cholesterol levels, you'll want to compare it to these ratios you see down here. Hopefully your LDLs will be less than 160 milligrams, and your HDLs will be greater than 40 milligrams. And depending on that ratio, your doctor might recommend that you, for example, eat less red meats, or increase the amount of supplements that you get. Like they can recommend certain kinds of supplements. And this is exactly what my doctor told me. My doctor actually recommended, because my ratios were getting a little bit to the dangerous side, my doctor recommended that I take fish oil pills. So I went out and I got some fish oil pills, and I started taking them, and I realized these things taste horrible. I don't know if you've ever had a fish oil pill. It tastes like fish. So yeah, obviously it's pretty horrible. So I did a lot of personal research into this, and I found something interesting. Dietary cholesterol, the cholesterol you have in your food, is not directly linked to blood cholesterol. Those are actually two different kinds of things. So there's actually relatively weak evidence that links those two together. To put it another way, increasing your dietary cholesterol is not necessarily going to increase your blood cholesterol levels. So taking fish oil pills, changing your dietary habits, that might help. Maybe it will help. But there's other things you can do that would definitely help, that you should probably focus on more so, like changing your exercise habits. Getting more exercise definitely is linked to cholesterol levels in your blood. But eating a fatty cheeseburger, not as direct of a link. So all I'm saying here is, while those things might be associated, dietary cholesterol, blood cholesterol, the link is very weak at best. So just something to keep in mind. Doctors, they know what they're doing, but they're people too, and they can make mistakes sometimes. They don't know everything. Nobody knows everything. So it's always pays off to look into things yourself. Trust your doctor, of course, but before you buy the fish oil, maybe you should see if it actually helps with anything. Now, when we look at social and gender issues and the health of young adults, we do see that people who come from poorer areas, people who live in poverty, are just less likely to get adequate health care. That makes sense. And they're more often to be in poor health, which also makes sense. And typically, people with a higher income will often get that income in correlation with having a higher education. So it kind of goes both ways. If you have a higher education, you're probably going to earn a higher income. And if you have a higher income, you have the capability of earning a higher education. So people from a higher socioeconomic status, their health is better for both of those reasons. They have access to those more expensive treatments and medicines, but they also have more information from their education about how to take care of their body. They understand nutritional things, they understand medical things, because they've gotten that kind of background education. So they're less likely to die from chronic illness. So this sounds really bad when you put it like this, but this is the truth. People who are rich tend to be healthier and live longer. Now, when it comes to gender issues, women typically outlive men. We see that consistently. We see that across pretty much every ethnicity. We see it in all nations. It's a very common finding, and the reason for that seems quite clear. Men tend to engage in more aggressive and risky behaviors. This is something I previously mentioned, testosterone. Testosterone, men tend to have that at just naturally higher levels, especially in young adulthood. And testosterone has been directly linked with violence and aggression. So men are much more likely to kill themselves and, unfortunately, kill other people when they have higher testosterone levels. And this is why we see men typically have a lower average lifespan. Now, when it comes to ethnic differences in young adults' health, what we typically see is just a reflection of what I've already talked about. Those socioeconomic status differences. Uh, I mentioned earlier that people from an African background do tend to live in like inner city neighborhoods, and these are the areas that generally have the poorest health conditions. They have a lot of poverty in these areas. So the men, African American men that come from these areas, they tend to have it the worst. So it's just a whole big combination of factors, but what it really boils down to in the end is just socioeconomics.